Okay, well, just to go over some frequently asked questions, a lot of our patients say, you know, I have asthma, I have COPD, I can't smoke. Well, technically that's not a true contraindication. I have a lot of patients who actually use the inhalation methods because it does dry out excess secretions. It may actually cause them to cough, have a more forceful cough to get stuff out.
Yes.
They were using THC in the PDR that we talked about to treat asthma because it actually bronchodilates. It's like albuterol, so it opens up airways. So just because someone has a lung disease doesn't mean cannabis is not for them. But there are other methods. If you want to not use your lungs, that's fine. They've got drops under the tongue. They've got sprays you can put in your mouth or in your nose, capsules. They don't have edibles in Florida. That's a whole nother political thing that's going on right now. But you can make your own foods. They've got patches and lotions, even suppositories. So we even have people who have women's issues. They use suppositories, colitis, proctitis, things like that. So there's a lot of different methods of use. Another frequently asked question we get, and again, I'm not a lawyer, so there's no, we just base it on precedent, is I can't use cannabis because I own firearms. So there's a lot of veterans who are not seeking our care that we really want to just educate. That is not the case. Our current Commissioner of Agriculture, Nikki Fried, actually carries both cards. She has a concealed carry and a marijuana card. So I really want to dispel that myth because you can still have your firearms in a concealed carry. That's a state law. Now, when you purchase a new firearm, this is where it gets tricky. We always want to be transparent. If you're buying from a dealer, you have to fill out a federal form that says, yes, true or false, I use an illicit drug, and that can prevent you from purchasing a new firearm. So there is that kind of fine line with it. Another frequently asked question is about benefits. As we explained, I had one patient who went back to work part-time so she could have the finances to pay for her cannabis medicine. Social Security tried to take back her benefits. I actually wrote a letter to the patient, and at the end of the day, they granted her full benefits again because she's contributing back to society. So that's it. The Veterans Administration also say they will not kick patients out just because they're using cannabis. They just can't do it in their facilities, right? But of course, you're going to have some doctors still with their opinions. There's a lot of different types of frequently asked questions, but CBD is one of them as well. So the CBD that you get over the counter is coming from hemp products. So when we talk about hemp and marijuana, the truth is they are both called cannabis plants. It's a terminology. Cannabis just refers to like the species of plant of which we can have hemp, which is a federal designation. It means CBD with a very, very, very minimal amount of THC in it. And then there's marijuana, which can have everything from CBD to THC and a whole big spectrum of it. So when you're getting over-the-counter CBD products, word of warning, make sure you know where it's grown, where it's being processed. The hemp bill that was just passed last year is now allowing hemp to be grown in the United States, in Florida, for example. But prior to that, 80% of hemp was being imported from other countries. So that doesn't necessarily mean it came from clean environments. Hemp for Water is actually a nonprofit that is in Okeechobee, and they are growing hemp to take out the toxins from Lake Okeechobee. So like that's an example. These are great plants for cleaning and filtering. So you just don't want that in your medicine though. So you need to make sure you have medical grade hemp, that your CBD is certified, grown, produced, and they have certificate of analysis that say it's a clean product.